Okay, you guys, so talking more about emotionally focused therapy, the model developed by Dr. Sue Johnson. So, in the first installment, we talked about the cycle that occurs between people, and I wanted to take some time to talk about what we call above the surface. So, above the surface is basically the things that other people see about us. And in times of conflict, these are the things about us that can cause further distress for us or cause further distress for other people. And there's three categories that we break this down into. At the top, we say behavior, and then we say perception or meaning, and then we have our secondary emotion or the emotion that people see. Now, what's interesting to consider is how behavior can be broken down further. Now, usually we can see this in two categories of more of a pursuing or reaching type behavior or more withdrawing or diffusing type behavior. And both of them are very meaningful. Neither one of them is wrong. It's just a strategy that we have developed when we are feeling uncertain about ourselves and about other people. So a more reaching strategy is really rooted in this desire for emotional closeness. I'm feeling distressed, and if I could have assurance of emotional closeness, then we can find our way to be together. Whereas a more withdrawing behavior is rooted in this, let's keep the peace, let's keep things status quo, because if we can just find our way to be together or just live in a solution, then we can move past this distressing emotion. And as we understand behavior, it's important to just consider for us what really is distressing. So one of the terms that we might use is micro cues. Sometimes it is just a glance or a clench of a jaw, just a subtle turning away, the start of a turning away, and that can really alert some of our under the surface pain or need. And other behaviors are much larger. So typical words we might hear is criticism or critical words, or walking away, turning away, leaving. Those are bigger categories. And then there's different flavors or different nuances of how we would further break down the behavior that people see. And what is really driving this is our perception or the meaning that we make about ourselves, the world around us, and other people. So it's like, I can never get it right, might be a perception that somebody might have. Or, here we go again, I'm not going to be heard. That might be something that a person is perceiving. There are these repeating statements that we notice, and when we're in times of distress, these words that just flare up in our brain and signal that we are not safe in the current situation. Above the surface as well, we notice something we call secondary emotion. These are the feelings that we allow other people to see. So this might be anger, frustration, tears or panic, anxiety. They're a little bit bigger emotions. They're harder for us to tuck deep away inside of us. And again, these are pieces or things about us that cause more distress for ourselves or other people. So I might say that these are emotions that show up more on the target, and that's why they're uncomfortable. We can feel shame, humiliation, or embarrassment for those emotions or the behaviors as well that show up in our relationships. Okay, so that's more about the top of the cycle or the above the surface stuff that other people can see going on for us in times of our distress.